Snoring, sleep apnea. Sleep apnea is pausing and breathing while one is sleeping. Those are two very common issues with our population here in the United States and really worldwide. What we have thought of in the past is when someone's snoring, that means they're sleeping peacefully, but we now know that snoring is actually very dangerous. There's a lot of comorbidities or bad things that can happen with someone's body because of snoring and with sleep apnea. Those are pauses in breathing while one is sleeping, and those accumulate over the night after night after night, and the result can be devastating. Hypertension, obesity, cardiovascular disease, Parkinson's, Alzheimer's. Those are just to name a few, diabetes, of the comorbidities that occur and that are associated with sleep disordered breathing. We look at that as really a number one issue that we want to identify if there is a problem there with our patients, and then give them guidance and treatment accordingly to help them breathe better. If you don't breathe, you can't live. And that's got to be number one. And it ties in perfectly with our temporomandibular joint and bite rehabilitation because it can be all related. And so if you or anyone you know snores, has sleep apnea, has daytime sleepiness, falls asleep easy when they're driving or reading a book in the afternoon, they fall asleep. There are many symptoms that occur daily that can be signs that you might have this disorder. And the long-term effects can be devastating. We'd love to help you because we're highly trained in identifying and treating any sleep breathing disorder that you might have. If it's something beyond the scope of dental medicine, I have a team of pulmonologists and neurologists with whom I work that I will get you into the right hands for that. So a lot of the times it starts here in my office with the identification of the issue and then a team approach to making you or your loved one healthy and breathing better again and enjoying life to the fullest like you deserve.